The rabies attack. First, the vector. The attack. A severe reaction, like what could be seen with the vector with the cat, could be foaming at the mouth and extreme agitation. The doctor's visit.
Hi, I'm Dr. Jackson. Why are you here today?
I feel so sick. I can't sleep at night. I'm angry. I can't even get in the shower. I'm so scared of it. And I've been throwing up.
Okay, well, I have an idea about what could be going on. We're gonna take you back here for some tests.
The pathophysiology behind rabies.
Okay, so rabies is a disease of the central nervous system, and it's actually a virus that can come from a lot of different animals. So it can come from cats and cows, dogs, ferrets, goats, any wild animals. And most of the time they're displaying the same characteristics as we saw earlier with a patient who has rabies. So they'll be foaming at the mouth, they'll be agitated, and they'll be just kind of scary. And the rabies virus is from the infected saliva, and it has to break skin, okay? So if the saliva gets on you and you don't have an open wound, then you're not going to contract the virus. There are 5 stages to the rabies virus. So there's incubation, which is when you have the virus and it's cooking a little bit. And then you have the prodromal period, where you just have, some symptoms, but the onset hasn't really set in. Then you have the neurological. Because it does affect the CNS, it can cause inflammation to the meninges and degeneration to the meninges, which is obviously very bad and can lead to the worst characteristics. And then you can actually go into a coma, and if you really don't treat it, then this can lead to death, which is why it is very severe. And it's good that there is an antiviral for this infection, because it used to affect a lot more populations, but now it's gotten better. Okay, so what's actually happening when the virus gets inside of you and when it's showing some characteristics? So you have an accumulation of leukocytes around the blood vessels, especially in the spinal cord and the brainstem area, which causes this degeneration of the meninges. And this is what leads to, a lot of the characteristics that we'll talk about later, like headache and some things that can cause the convulsions. And just for you to have all of those neurons inflamed all at once is what causes a lot of the characteristics.
Possible risk factors in getting rabies.
All right, so something that could put you at risk for rabies is living in underdeveloped countries like Africa or Southeast Asia, because there's lots of wild animals around there. And working with animals in a laboratory could also put you at risk because you're constantly with them. Or working in rural outdoor environments. So basically anywhere where you're with these animals, but probably not in the United States as much, but definitely in other countries.
The manifestations of rabies.
Manifestations, as we saw earlier, initially you're going to have, in those prodromal characteristics, you'll have a headache, you'll have fever, you'll have nausea, vomiting, just general muscle cramps, and obviously this can include to a lot of different disorders and diseases. So these, don't really give the doctor what they need to make the diagnosis. But as it progresses, we can have anxiety and confusion, hallucinations, in which a patient or someone afflicted by the disease is seeing things that aren't there, has different sensory experiences, smelling things that aren't there. Also, excess salivation, the classic rabies, foaming at the mouth, agitation, reacting, inappropriately to a lot of stimulus, and fear of water, which is, that's something that can help to diagnose it just because it's so specific and kind of random. And as it progresses and it affects more of the brain and spinal cord, that's when we can have paralysis, You can actually have a coma and you can die. And then there are also some systemic effects like congestive heart failure, and you can have a GI hemorrhage, which are also causes to worry and causes for trouble. Just in general, because of these characteristics like anxiety, confusion, and agitation, this disease can have a huge effect on daily life and relationships, especially if they don't know what is causing this. Relationships can deteriorate, and there can be a lot of stress at home and in the household. So it's really good to recognize these early on, especially if you've been scratched or you've drawn blood and been in contact with a wild animal, to go to the doctor right away and figure it out.
Testing and diagnosis.
So we're gonna take some blood, and then we're gonna run some tests.
Hurry!
And you're done. All right. All right, get somebody in here. Mary, you have rabies.
What?
Yeah.
No!
Get her down.
No!
Miss Rice.
Am I gonna die? Am I gonna die?
No, but we're gonna restrain you because you're convulsing.
Get off me!
All right.
I'm sweating!
Uh-huh.
Treatment and care for rabies.
All right.
First,
Shot.
the antibody.
Ow!
All right.
Day
Shot.
3.
All right.
Day
Shot.
6.
All right.
Day
Shot.
9.
All right.
Day
Shot.
12.
All right.
Day
Shot.
14.
Okay, so with the treatment, as we saw earlier, there's a lot of different injections. But right away, when you are bit or been in contact with an animal that you think is displaying characteristics of rabies, you want to wash it out with water and soap and iodine if you can. And then obviously go right to the doctors. And for the treatment, they'll first start with the rabies antibody, which just kind of prevents the virus from getting a foothold, from the virus developing and going to those later stages of the neurological and the coma, and then obviously the death stage. We don't want that. And so then over time, over the next 14 days, there will be a series of 5 shots administered that help to fight this infection that's obviously a viral infection. So these aren't antibiotics, they aren't antifungals. This is a virus, so they're strong antiviral agents that help to fight rabies and then prevent the further damage to the meninges and to the brain and spinal cord.
Some nursing interventions for rabies.
Alright, so some interventions that we could do as nurses is to wash out the area where it was bit or scratched with soap, water, and iodine, and rinse out with saline, but not injected because that could spread the infection to other parts of your body. Okay, so any other normal interventions that you would use for injections, like checking the skin site of where everything was injected and making sure there's no skin breakdown. And also another treatment is possible tetanus injection, because that could help. And another thing as nurses that we can always do is providing emotional comfort and like seeing what the patient wants, listening to them and responding, providing good environment for them and anything else that they could want to help them make them feel better or anything.
This video was made by nursing students for nursing students in Miss Woolston's pathophysiology class. We hope that it helped. Remember to watch out for the general manifestations, those early signs and symptoms that could clue to the rabies disease, and remember to use proper nursing interventions in your care. Some outtakes.
Wait, well, you're literally like. Okay, like. You need a bite, right? A bite. He literally bites all the time, so I thought it would be so easy.
Okay, I'm gonna go put him in the microphone.
Oh, there we go. Did that hurt you?
I have an idea about what could be going on. We're gonna take you back here for some tests. There's no freaking dog.